How is AFP used in liver cancer diagnosis? Imagine a tiny protein that can tell us a lot about liver health. That protein is called alpha-fetoprotein, or AFP. It's normally made by a developing fetus's liver and yolk sac, but in healthy adults, AFP levels are very low. When it comes to liver cancer, especially a type called hepatocellular carcinoma, AFP can become a useful clue for doctors. Doctors measure AFP through a simple blood test. This test is part of the process to diagnose liver cancer, especially in people who are at higher risk. Those at risk include individuals with chronic liver conditions like hepatitis B or C infections or cirrhosis. When AFP levels are high, it can suggest the presence of liver cancer, but it's not a definitive answer on its own. Elevated AFP can also happen in non-cancerous liver problems such as inflammation or liver regeneration, so doctors interpret these results carefully. In screening for liver cancer, especially for people at high risk, AFP testing is often combined with liver ultrasound scans. The guidelines recommend checking AFP levels and performing ultrasounds every 6 months. This combined approach helps catch liver cancer early when it is most treatable. If AFP levels are above certain thresholds, it raises suspicion. For instance, AFP levels over 400 nanograms per milliliter are considered highly suggestive of liver cancer, especially if imaging shows a suspicious mass. Levels above 200 nanograms per milliliter also increase the likelihood, but they are less specific. It's important to remember that about half of liver cancer patients may have normal AFP levels, so a normal AFP does not rule out cancer. AFP's limitations mean it's not perfect. Elevated AFP can be caused by active liver inflammation, benign liver growths, or other cancers. Because of this, doctors do not rely solely on AFP results. Instead, they interpret AFP levels alongside imaging studies like ultrasounds or CORT scans and consider the patient's overall clinical picture. AFP can also help in monitoring treatment response. If a person is being treated for liver cancer, decreasing AFP levels can indicate that the tumor is shrinking. Conversely, rising AFP levels after treatment may suggest the cancer is coming back or progressing. Researchers are also exploring other blood markers, like AFP-L3 and des-gamma carboxyprothrombin, which can improve diagnostic accuracy when used with AFP. In summary, AFP is a valuable blood marker that, when used alongside imaging, helps in detecting and managing liver cancer. Elevated AFP levels, especially above 400 nanograms per milliliter, strongly suggest hepatocellular carcinoma in the right clinical context. However, normal AFP levels do not exclude cancer, so doctors always consider the full picture. If you have concerns about liver health or risk factors, it's best to consult a healthcare professional for personalized advice and appropriate testing.